Hi, I'm Nicole Edwin. I'm an integrative oral functional therapist with Oral Infinity, and I offer pediatric feeding, myofunctional therapy services, lactation, and craniosacral therapy in the St. Louis region. You might be wondering, what is an oral functional therapist and why is that important? Well, I've been asked here today to do a short series on how oral function is the beginning of our digestive tract. But not only is that, oral function, or primarily tongue function, is the start of our entire digestive tract. It's also what drives optimal craniofacial development, supports sleep and airway. It's so important and we don't even realize it. So I happen to start working primarily with infants who are having breastfeeding difficulties or feeding difficulty in general. But how this presents in the older population to include picky eating in children, sleep disordered breathing, and orthodontic needs in teens and even in adults, but also on up to obstructive sleep apnea and overall gut disruption. So why would that start here? Okay, well, obviously we eat, right? We need our tongue, we need our lips, we need our cheeks, we need all of the muscles of our head and neck to start swallowing. And if we have disruption here, what happens? We have a snowball effect. So I really briefly want to touch on what are some things we might be looking at? What are some issues that we might be seeing in the broad population if we have dysfunction in our oral facial complex? We might have, like I mentioned earlier, picky eating with children, difficulty feeding with breastfeeding, difficulty with speech. We might actually have some of these issues arise from GI disruption because of allergies. So if it can't go in or if it can't go out, it kind of works the same way. We have sphincters, multiple. I went lower. And we have diaphragms here, and below. And they're actually all connected. Our entire body is connected. And when one of these is off, it affects another. So tongue ties happen to be a specialty of mine. But I do have people that come in with difficulty with all of the things I had mentioned earlier. And with adults, a lot of times we'll have chronic head and neck pain, clenching. There's so many reasons for all of these symptoms. But when I'm looking at an individual, I'm looking at what is the root problem? What could be coming from the tongue? What could be coming from the jaw? What could be coming from the muscles of the head and the neck and the face? As a craniosacral therapist, I can use my hands to help me listen to the body and say, is this coming from the body or is this coming from up here? And how can I help? You might think physical therapy for the mouth. Why would somebody need physical therapy for their mouth? Why would you need that? I swallow fine. I have no issues, right? I hear it all the time. But when a child comes in for orthodontic needs and they might have an underbite, think like a bulldog, right? Or a crossbite on one side, the difficulty arises in feeding, in chewing, in mastication. And when we have that disruption, if food is not properly chewed, we have more work to do in the GI tract. Dr. Malone will talk more about what happens below here, but what I want to touch on is why it's actually important. When I have a child who comes in who's a selective eater, it could be for a number of reasons. It could be sensory processing, it could be motor deficits, it could be weakness. There's so many reasons. The tongue could be tethered to the floor, so they develop compensations that actually have a snowball effect with a lot of tension in the head and neck. I'm a 36-year-old who just had her tongue tie released finally. Where did those symptoms present? Actually in my dura, in my neck, in my spine, in my back, both mid and low back. You didn't see it in my speech. You didn't see it, or you didn't hear it in my speech, and you didn't see it in my swallow. It showed up elsewhere. So why would a little tether underneath the tongue affect that? If the tongue can't rise to the roof of the mouth. So I describe this with a lot of my patients. We have our lips, and this comes from another amazing oral functional therapist. Our lips are our braces. natural given, and our tongue is our natural tongue expander. And when our tongue is properly swallowing, it actually is regulating the nervous system. It's helping release hormones from the brain that say, I'm calm and I can go into rest and digest. When we're properly swallowing with our lips, and this is with the older population, with our lips together and in a rotary chew, and it's going down cohesively down our throat, we get a prime start. So if you kind of think about this analogy, if you wake up late, you didn't get your workout in, you didn't eat right in the morning, it just snowballs into the rest of your day, right? And by the end of the day, you're just done. You're stressed. You can't handle it. This is our morning. And if we get it right here, it makes the rest of our digestion that much easier. It allows the rest of our body to move in optimal function. And as we grow in infancy, and as young children, when our tongue is up to the roof of our mouth properly and we're properly swallowing and we have our lips together and we're breathing through our nose because we're getting filtered air, there's so much beautiful opportunity. And we don't have to think as much about the dysfunction because we're setting up a solid foundation from the top down. Have a wonderful day. You can find me, Nicole Edwin, at Nicole@myneonourish.com. And my website is www.oralinfinity.com. Thank you.